welcome everyone. Today I'm here with Kelly from Applegate. My name is Tyler Phillips, and today we're going to be asking Kelly a couple questions about hospice care. So, without further ado, we'll get right into it. Just so you guys know, this is a live, so if you guys have any questions, feel free to drop them in the comments, and we'll answer those questions for you guys. So, let's get right into it.
Okay.
So, thanks for being with us, Kelly.
Absolutely.
First question we have is, how does the hospice care team support both the patient and their family?
So when we're looking at hospice and the support that hospice gives, we look at hospice as a new chapter in one's life and a new journey. And so everybody's journey is different, and everybody likes things done their way, and they like things done, according to their wishes and what's going to be helpful, what may not be helpful. So the team is there to support both patient and family. Our focus with the patient is supporting the patient physically, emotionally, and spiritually. And a lot of that is through symptom management. If a patient is experiencing pain, anxiety, we want to make sure that those needs are met. And also emotional support. Emotional support is very important during this time for both patient and family, as for some patients it's a very difficult time. A lot of emotions play in, and also for family members it's also very difficult. So we want to make sure through our social worker that our families and their patient, their loved one, has that support, however that looks for them. And then spiritual support is really focusing on patients. We respect their religion and their religious beliefs, but sometimes people will have questions, and if they're to ask a CNA, they're going to be like, I don't quite know how to answer that. And that's why we have chaplains set up in hospitals and stuff, so that they can have that spiritual support, and the chaplain can talk through those questions with patients. And it is very, very helpful in many, many ways with hospice patients.
Perfect. Thank you, Kelly. That was a great answer to that. Another question that some people kind of think about sometimes is how is hospice care paid for?
So hospice is covered at 100%. And so you have your hospice team, which has your medical director who takes over your care. So the medical director of hospice takes over your hospice care and is pretty much in charge and leading the team, along with the RN, registered nurse case manager. And then we have a CNA, we have our social worker, our spiritual coordinator, and that is all funded at 100% by Medicare, as well as any of the medications, again, focusing on symptom management. Those medications are ordered by the medical director, and that is covered at 100%. And any durable medical equipment needed, a hospital bed, wheelchair, walker, bedside commode, anything that doesn't attach to the walls but is going to provide a better quality of life for the patient, that is delivered at the home, and that's covered at 100%. So I think it's a beautiful program that Medicare has put together for one's end-of-life journey.
That's awesome. That was really great. Can you share some common misconceptions about hospice care? I feel like there's people are kind of timid sometimes when it comes to hospice care, just because they feel like it's where they go to die type of thing.
Absolutely. So one of the biggest misconceptions that I hear quite often when I'm speaking with a patient and their family about hospice is that they've had an experience, and this kind of goes back a few years, and where people say, well, hospice comes in and they put my loved one in a hospital bed, or a patient may say, you're going to put me in a hospital bed, give me a lot of morphine and help expedite my death. And that's not what we do. We look at this as one's final journey, and how does this journey look for our patient? And it's about living each day and providing the best quality of life we can, so that the patient is able to do the things they enjoy doing and spending that quality time with their family. And I've said before, making bucket lists. And so we're not coming in with an attitude, you're dying and we're here to help you die fast. We're coming in with the attitude, we're here to support you, to love you and your family, and let's focus on your quality of life each day. We're going to take it one day at a time. We're going to focus on goals that patients have, And so I think that's one of the biggest misconceptions. And actually, some people actually live longer when they go on hospice. Not everybody, but there are patients that actually do better because their symptoms are being managed. They've got the support in there. And so actually, when patients learn more about hospice, it's kind of like that relaxation, take a breath. Okay, this feels much better. So I like to look at it as let's join this journey together, and we're not going to focus on death because today's a gift for all of us and tomorrow's not promised. So that is a big misconception about hospice. So that's the good side of hospice.
That's perfect. I love that. And then before we get to our last question here, I'm going to go check to see if we got any comments. All right. So we'll get into our last question real quick. It is kind of a big one, honestly. I feel like this is kind of one of the hardest parts of hospice is having the conversation about it. So the question is, how can someone initiate the conversation about hospice care with their loved one and healthcare provider?
That's a good question. There are many different diseases. I'm going to name a few that we typically see with hospice care, and we have cancer and ALS and heart failure, pulmonary issues, and then of course Alzheimer's disease. And so when someone, for example, is really starting, you notice your loved one, or you're on this journey with them where they're getting treatment for cancer, and unfortunately treatment is no longer working and the cancer keeps spreading, and a patient is really getting worn out and really struggling to continue treatment, or somebody that has heart failure that's in and out of the hospital, and it just really comes to the point where, is quality what we're searching for, or do we want to still continue with quantity? And I think that when you're starting to see that we might want to focus on quality of life at this time, I always encourage people, for instance, I will offer to do a hospice education with patients and families, with doctors and providers that I work with. I will go out and have that conversation, and then I always encourage them, after we've talked, have your conversation with your provider as well, and tell your provider if you are interested in hospice, what are your thoughts? And just a lot of times we're so close with our doctors that have been treating us, and we really trust them and we trust what they say. And so as an added security for a patient, or something that's going to make them feel better about, this is a big decision for many, that kind of helps to have that conversation. And then of course, families coming together and talking and discussing. We have what's called a hospice starter conversation kit, and it has a lot of great questions in it that people can sit down and discuss amongst each other, and kind of the big elephant in the room, we're kind of pushing that out of the way and having those open conversations. And of course, it's always up to a patient when they want to start hospice. Nobody's ever going to force them or push them into it, but it's good to start having those conversations and making plans. Oftentimes our loved ones will say, my parents said I am a DNR, do not resuscitate, I don't want to be ever intubated, I don't want a feeding tube. So those are important conversations to have. So if you're ever faced with making a decision for your loved one, you know what their wishes are. And I think that kind of helps to have those conversations.
I like that. That's really good. That's really insightful. Well, perfect. So that's the questions we have for today. Thanks everyone for watching, and you can always feel free to rewatch it on our Facebook and Instagram pages. If you guys have any other questions and you guys weren't able to make it for this live, feel free to send us a direct message through Facebook, Instagram, even YouTube actually, and we'll be sure to answer those for you. So thanks, Kelly, for being with us.
Thank you. Appreciate it.
Sweet.